What is up, everybody? Welcome to the Nurses Station. We are here this week with a very special guest. Let me go ahead and just bring him in. Jamey, can you hear me?
I can hear you great, Mike.
Right on, right on. So Mr. Jamey Edwards is the CEO of Cloudbreak Health. And this dude's a four-time honoree of the Ernst & Young Entrepreneur of the Year Award. I think he's got two brains up there. And I don't know if you guys see the guitars behind him. This guy's got the brains. He's got the talent. We're going to bring him on tonight. We're really, really excited to have you on the show, man. Thanks for being here.
Really, really excited to be here. Thank you guys so much for having me. And trust me, there's only one brain, but a lot of luck.
Yeah. Well, we just want to thank you for being on such short notice. We know that you're really good friends with Nick Adkins, and he had some stuff come up and couldn't come on. So we are just very blessed to have someone of your caliber to be able to step in and have a great conversation with us. So this is going to be awesome. We'll talk a little bit about the pink stocks because Nick said that you were an OG when it comes to that, but we'll talk about that at the end. But we really want to talk about what you're involved in, and I'm just really excited to hear from you. So take it away, Mike.
All right, man. So everybody, please fire us your questions. Okay. If you have any questions that come up, if you just if you just want to leave a comment, hey, this is awesome. Just let us know. This is your time to take a moment and interact with some of our amazing guests that we have on the show. So, fire away anytime. But first, I'm firing away. I want to know, what is Cloudbreak Health, man? Tell me about it. Well, it sounds amazing. I want people to hear about it.
Yeah, Cloudbreak Health is a unified telemedicine platform. We bring together all of the specialties on a single device. The company was originally founded back in 2003 as a company called the Language Access Network. And I got involved in 2008 when I took over as CEO. And the company's core product was bringing interpreters to the point of care for limited English proficient and deaf patients. And we did it over our telemedicine platform. And the company's grown pretty dramatically over the course of the last few years. We're now in 800 hospitals plus across the country. And we do this over 85, 90,000 times a month. So we're kind of one of the largest telemedicine company no one's ever heard of because we're behind the scenes more often than not, but out there doing good work.
That's awesome. That's awesome. Telemedicine is huge, man. It really is a big deal. One of our guys, one of our very, very lucky, very fortunate communication team members, the nurse doc, Dr. Wesley Willis, he lives on the road. That's what he does, man. Telemedicine. Yeah. This guy, one week he's in Australia, the next week he's in the Philippines. I mean, the guy is just all over the place, and he lives his life seeing patients through telemedicine. I think that is amazing. It's amazing.
Yeah, there's a huge disruption underway right now, Mike and Blake, with everything that's happening. The place-space relationship that we used to have with hospitals is changing, and the location ceases to be as important as the care team, which is why we gotta show love to all our nurses out there who are taking care of all of us. It's an important part of it. But I think as things evolve, more and more is going to get done with telemedicine. And if you listen to the press would say, telemedicine, why isn't it being adopted faster? And that's because they're referring to your standard business to consumer telemedicine. Why aren't more people using American Well or Teladoc or what their insurance company provides? But the fact of the matter is that telemedicine is widely used in hospitals across the country for things like telestroke, for things like tele-ICU. There's a whole business to business world where telemedicine is saving lives every day at hospitals across the country.
I have a friend named Craig, and he is an ICU nurse, and he and I met through Twitter. And for most people that are on the show, that see the show, they know that I'm always on Twitter, and so I meet people all the time.
By the way, Mike, guilty as charged as well. It's the one social media platform where I tend to get a lot of value and make real relationships. So yeah. I'm curating my feed.
Exactly. I love it, man. I love Twitter. Right? I meet people just all over the world, man, and I've made some great relationships, with these people. Yeah. Craig is one of them. And one day he was in Dallas, and he said, "Hey, I'm going to visit some family. My wife's family's from Dallas. Let's meet up, for coffee." So I said, "Hey, man, that sounds like a great idea." So he came in. I took him to the very first. He's never been to a Starbucks Reserve, right? So I took him to a Starbucks Reserve. And
by the way, what is that?
Starbucks Reserve, what is that?
What? Are you serious?
Yeah.
Okay, so that's okay. That's a different conversation. But Starbucks Reserve is like,
hey, no plugs, Mike. We're not plugging here.
Right.
I'm kidding.
I mean,
Like if you're on Twitter at Starbucks, right?
it is amazing. There's only 2 in the state of Texas, and they're both. No, actually, they just built a 3rd one in Texas, and so there's 2 in Dallas and 1 in Austin, and they are amazing. So anyway, I took him to this. And we got started talking, and I found out he was an ICU nurse, but he's a telemedicine ICU nurse. So he is at the bedside, like tele bedside, right? And he is always monitoring. He's not the primary nurse for each patient, but he monitors the equipment. He's monitoring, the patient. He assesses the patient. I never even knew there was a thing like that.
Oh, yeah. Yeah. And the interesting thing about telemedicine is you're going to hear a lot of people talking about something that they call webside manner now instead of bedside manner. And it's all about how hey, I swear. It's all about,
that's great.
Yeah, webside manner. And it's all about how you train to be on a video call and make the patient feel like you're in the room with them. It's a big part of it.
Well, I think you bring up an amazing point because when I've had these conversations, and Mike's on the clinical side, I was on the clinical side, I've moved into the administration side. And, every time telehealth comes up and in the informatics world and everything, there's always those, especially in the nursing profession. And I know it happens in medicine too. We've been taught, that compassion, that expectation of compassion and how do we get through the technology to make sure that compassion isn't lost through technology. And I think there's definitely a way to do that. But that's always the pushback initially when individuals are especially not familiar with what the aspects of telehealth can do to increase the access for individuals. I mean, Mike lives in Texas. I live in Nebraska. And even where you live in Buffalo, I mean, New York, there's places in New York where there's just not the support of healthcare that is needed for individuals. And so instead of all moving out there and, that's not really a realistic goal. I think in this day and age to say, well, then we just need to move all of our clinicians and our providers out to the rural areas. You can't support that.
That's true.
Financially and cost savings wise, you just can't. And so I think telehealth is definitely something that we need to move forward with and explore. And as nurses, we need to be at the forefront, not be reactionary, but we need to be proactive and work with individuals like yourself, Jamey, of getting through that compassion part of it. How does that look? How is it scripted? How do you interact? And I think we as millennials, a younger generation of this profession, that's where we come and help from day one, because we've grown up with technology. And so that's how we contribute, even on top of all of our clinical skills.
Yeah. Well, look, I think, when we were thinking about who we wanted to be as a company and we initially took a look at our mission statement, it sounded a lot like everyone else's mission statements in healthcare, right? It was, we are trying to build a more cost-effective, higher quality, compassionate healthcare. Like, whose mission statement in healthcare doesn't say that?
I'm just falling asleep there.
Yeah. So when we took a step back, we said, God, what are we really trying to do? And I cut my teeth in healthcare on the provider side. So I used to be the CEO of an ER hospitalist and anesthesia group in Southern California called Emergent Medical Associates. And they were in 40 different hospitals and seeing about 1 million patients a year. And one of the things that I witnessed was that, doctors working their shifts, or the nurses, for instance, like, that's an athletic event. That is an 8 to 10 hour to 12 hour athletic event. And what you see is people trying to cope with some of the heavy stuff you have to deal with on a daily basis in healthcare. And they started to be desensitized to it. And from our perspective, when you're also asking physicians and nurses to document an electronic medical record and do those types of things, the natural outcropping of that is they spend less time with the patient and more time on the technology. So we took a step back and we said, you know what? Every patient is a story. Every patient needs to be treated like a person. And by the way, the patients need to treat their doctors and nurses like people too, as opposed to something that they were feeling entitled to. Well, my insurance pays for this. I'm going to treat this doctor or this nurse or this lab tech or whatever it is as I see fit because I'm the one in pain here. But there needs to be a little bit more mutual respect and compassion. And so we came up with Humanize Healthcare, and we lead a Twitter discussion at #Humanize Healthcare, where people can engage in the discussion of really how we can treat each other like people as opposed to like objects, which, by the way, is the #1 symptom of physician or nurse burnout, which is a huge issue in the country. So for us, we wanted to address that head on, use the technology to actually build a relationship and build a rapport between patient and provider. And for us, it was a big differentiator when we first started talking about it, and it still is today.
Yeah, I love how you said humanize from a patient to clinician and provider as well. Because you know this very well, working in the healthcare field for so long, and Mike, I can speak for nurses, but I've talked to many physicians. We're kind of like unsung heroes. We don't want to. We shy away from the limelight. It's not. I mean, we're there in it for the patients, and that's always the way it's been. And we need to step back, and we don't reflect enough, I believe, in taking care of ourselves. That's always been an issue within the healthcare field. But I think what you have to look at is what can we do instead of just telling a patient, well, you need to treat us better. Well, that's going to be divisive and not help the situation. I think what we could do to make that better is by bringing them into our world as much as possible. We know that PHI is something that restricts a lot of things that you
little thing called HIPAA.
Yeah, that you can't just bring someone along on your shift like a ride along. Like you can go with cops. So there's not live PD for the healthcare world. That's real time, like something like that. And so, but what we could do is do things like this. Broadcasting, showing them who we are, what a daily, the daily life looks like. Show that we have families. Show that we interact outside of just that hospital setting, and I think that could help humanize us a little bit more, because when they're in those vulnerable positions, that's not when they're thinking about us as humans. They're worried about themselves, and they rightly should be. Because that's our role as nurses and physicians in the healthcare team, to help them with those things. So I always preach that we've got to get out to the public when individuals are not sick and show them what we do and how we impact our communities. And I think they know we impact communities, but at the same time, they don't know the scale or the scope or the role that we truly play in society, on top of our first responders, who I have incredible respect for, and rightfully they deserve all of that accolades and the things that they do for our society, because they should. But I think that nurses and physicians and other people in the healthcare field, as well as some other professions, they kind of go under the radar. And nurses and physicians, we don't do a good enough job of getting out into the limelight in regards to being on the everyday basis instead of just talking within our professional scope. I think that's one aspect we could do.
Yeah, Blake, I think it's a great point. For me, the equation has always been unbalanced, right? At any point in life, a nurse or a doctor will be a patient, but the reverse is not true, right? A patient is not going to, a patient might become a caregiver at some point for a parent or something like that. But it's much different than being a nurse or a doctor who is literally giving care the entire day, and to know how invested you might become in a patient. So for us, it's always been about communication. I recently had an emergency appendectomy on a trip back to see my mom in Buffalo. And I actually went out there to be her caregiver. She was going through something. I went out to be her caregiver. And while I was there, and I was literally supposed to be there for 24 hours, I ended up being the one who needed to be taken care of. I ended up in the hospital. And while I was sitting there in the emergency department waiting to go in for surgery, I was like, man, I would just love it if they came in and just let me know, hey, we ordered your labs. They're not quite back yet, but we want to know we're paying attention to your case. And one or two more times of someone come in, touching your hand and letting you know they're thinking about you as a patient is a critical thing. And on the flip side of that, how many patients, when you show up at a doctor's office, you're sitting there, doctor's a half an hour late, right? And you're like, oh, I can't believe they're wasting my time like this. And you feel offended. But if you knew that that doctor or that nurse was spending time with a patient who just had a terminal diagnosis, wouldn't you be a little bit more understanding and compassionate if you could just walk in that person's shoes and understand the context a little bit more? So that's like an example of how HIPAA sometimes stands in the way, because the doctor can't come and be like, oh, I'm really sorry I'm late. They just have to roll to their next appointment. And by the way, everyone's in healthcare, you're constantly being asked to do more with less. We are constantly being asked to see more patients per hour.
That is absolutely true.
Document, do all these different types of things, and the burden just keeps getting higher and higher and higher. And so where's the time to spend with the patient? Where's the time to build that relationship so that you appreciate the patient and the patient in return appreciates you?
Exactly.
This is humanizing healthcare.
This is humanizing.
That's what we're talking about.
Absolutely.
Well, listen, hey man, this has been great. We're gonna have to wrap it up here real quick, but I'd like to talk real quick also about the Pink Socks movement.
Yes.
And you and I have a common acquaintance, common friendship with Nick Adkins. And how did you get started with this Pink Socks? A lot of people don't even know what Pink Socks are, right? And and unfortunately, and I've posted actually Nick's TED Talk. So I would say to all of you who are watching this, check out the TED Talk Pink Socks by Nick Adkins. And I will have, by the way, we have an upcoming conference. The AAMN conference is in October. And I'm loading up a box of pink socks. I'm going to be giving out the pink socks to everybody. So that'll be pretty cool. Yeah. But anyway, fire away, man. Let me hear you. So how did you get started? I
saw Nick at a conference a few years back, and I'm like, who is that guy? Like, he's very unique, right? Shaved head, wearing a hat, nice sized beard, a kilt, and army boots. And I'm like, I got to meet this guy and figure out what's going on. And he's wearing, of course, the pink socks with all of that. Yeah. And the whole way the Pink Socks movement got started was Nick was a buttoned up healthcare executive, kind of like a lot of us. And he went to Burning Man. And one of the tenets of Burning Man was radical gifting, amongst other things. And so he loved the way that people just gave of themselves and created this ecosystem where people just would give each other stuff that would help you sustain. And so he came back and he had a friend who had a socks business. And I guess the pink mustache socks were slow sellers. And he started to hand them out at healthcare conferences. And the first people that he handed them out to were like Eric Topol from the Scripps Translational Institute and Jerome Toss. And it was him and a guy named Andrew Richards. And both of them started handing these socks out. And there was nothing expected in return. And the socks didn't mean anything besides just being a gift, right? So #gifting on Twitter. And as he started to do this, more and more people started to wear them and assign their own values to it. So for me, it became about healthcare innovation and people who are trying to change healthcare for the better. And so very early on, Nick and I kind of, partnered up, if you will. I really bought into the ethos, and Pink Socks as a result is, over 40,000 pairs of pink socks have been distributed across the world.
That's amazing, man. That's amazing.
Put that into perspective. You're talking about a movement that's just a few years old, right?
Yeah.
And companies like Cloudbreak have gotten behind it, and we actually give them out as gifts at conferences. And for Nick, it was all about brightening someone's day and having that conversation piece and having that common ground when you saw someone else wearing pink socks saying, hey, I really like your socks. And be like, oh, you're a pink socks, I'm pink socks, let's have a discussion. And it's really, for me, taking this social sphere on Twitter at #pink socks, and it's brought it into real life. And I love going to conferences now and meeting other folks in the Pink Socks tribe. And if you go to pinksocks.life, people have shared their stories of how they've gotten their socks and what they personally mean to them.
It's really amazing. Everybody out there, everybody that's on Twitter, for sure, you got to #Pink Socks or go to the pinksocks.life. I mean, just amazing, amazing stories. I got my first set of pink socks. Let's see. It was a guy named Ignar, and he's from Norway. You know Ignar?
Ignar Rip,
Yeah, Ignar Rip from Norway. He mailed me some pink socks. And so this gentleman is amazing. He's an amazing guy. And he does a lot with Alzheimer's disease, right?
Yep.
And he has a whole movement out there going on. It's just unbelievable, man. It's really, really, it brings people together, but it gets a good conversation going. And again, Twitter, man, I love it.
Yeah, for us, it was like we took a look at it, and it played right into what we were trying to do in Humanize Healthcare. It allowed us. It was almost like it created connective tissue between us and other people. And we find it's amazing to be a part of the community.
That's awesome, man.
Yeah, when I read, because I didn't know what pink socks were at all. And Mike's was like, you just need to look at this pink socks, man. He was just like, Mike, you can see it right now. He was just like all hyped up and,
I'm always hyped up, by the way.
Wall for pink socks. I was like, what are you talking about? And I went onto the website, and I just think it's so cool when I read the About Us section. And it's pretty lengthy because and rightfully so, and kind of how this all came about and the concept behind it as you describe in your own way, Jamey. And to me, it's really about moving into what the theme I got from a healthcare perspective is that it's really coming into an interdisciplinary team and how we communicate with one another and how we bring our own views and our own expertise to the forefront together to better healthcare and breaking down silos. Because people say I'm a DPT, they start throwing I'm a MD, I'm a DO, I'm a MSN, I'm a PhD, AARP, blah blah blah, and they just go on and on. And that's great. We should all be very proud of all of the expertise that we have, but it really means nothing if we don't execute it in the correct and efficient manner that it needs to be in this complex healthcare world to better the outcomes of our patients, period. And so I think that concept of something so, I wouldn't say trivial because it's not. I mean, it's the meaning behind a pair of socks. A pair of socks itself could be it's just a material, aspect, but it's the meaning behind it of the awareness factor that all of us need to come together and think outside the box of breaking down the silos of communication when we're not only taking care of our patients, but as we're collaborating as professionals. And that's what I think is so moving from it.
Yeah, totally agree, Blake. And, from our perspective and mine personally, it was everyone wants to belong, right? Everyone wants to belong to a community. And the pink socks, they're free. And no one makes any money off of it. It is a completely free, fully gifted type of thing. So you get to feel good about having contributed and brought someone into the community. But when you meet up at conferences, I mean, it's amazing. You will not find better meetups at a conference than the Pink Sox meetups. So for all those who are attending them, it's a bunch of really great, nurturing people who are innovative and who want to do the right thing.
I would just say, Ryan, I just want to make a comment was put in. Ryan, who's one of our members, he said, now I'm really sad I can't make the conference. Yeah, and he said #PinkSocks. So he's well aware of what it's all about too. And Mike, I'm so glad you're bringing a box of those.
Oh, I think for sure.
This is something that I think our organization. This is what it's something that means something special to us too in regards to what Pink Socks means, just as where it's coming from. And I think it's something that we need to explore as an organization, be the first, maybe, I don't know how many nursing organizations are a part of this or if they're officially backing this. Cause I know like Cloudbreak and others are behind this. Maybe that's something that we need to truly explore, because I think that's why we're in this. We're not in this to have conferences and to sit around and come together and just hang out. We're coming together at a conference to create action and execute something to better our communities. And there's nothing better than to have a symbol of that and to back something as a symbol of that. And how cool to be with a bunch of guys walking around with pink socks, because I love it. But
it's classic. I'm telling you, walk around like hymns, or we're part of Startup Health. So the Startup Health Festival in San Francisco, and just people have them on. And the second you do, it's just like this very knowing look, right? You're like, oh, all right, we're part of the same tribe. It's a cool thing. And you know what?
Immediate connection.
Can be a part of it.
Yeah. Immediate connection, right? I mean, it just opens a conversation right away.
Ooh,
Well,
Mike-
listen, that's it, man. We're gonna wrap
Lost
up.
Mike.
Yeah, Ryan just states that how about he says the new thing that AMN should do is every new member gets a pair of pink socks.
See, there you go. I like that.
Hey,
That's perfect.
I
I like that. Tell Ryan, by the way, Ryan, if you're out there, we'll make sure you get a pair. Don't worry.
You'll definitely get a pair, Ryan. All right, I promise. I promise. All right, we're gonna wrap this up, guys. Thank you so much, Jamey. Really, really appreciate it. And I hope that maybe
All
sometime.
right. I think we lost Mike, Blake. I think he's.
Oh, did we? Did you lose it?
Am I out? Can you hear me?
Yeah, I can hear him, but you can't, Jamey.
I cannot.
Oh
Okay.
no.
So I'll speak for Mike. I will be the medium of Mike through me. But we just want to thank you for being here, and especially on so late notice. And I think we've only hit the tip of the iceberg in regards to this telehealth aspect. And we would really hope as we move forward, I think it's something we need to talk about further. And if you'd be willing to come on when we just dive into this telehealth aspect and what we can do as nurses. I don't think nursing has talked about it enough. And that's what we really need to do. And so we would welcome you back.
I would be happy to. Anytime you guys want to dig deeper, let me know. Okay, kids, come here for a second. Oh, come here.
Yeah, if you're gonna come on, you're gonna come on live.
Yeah. All right. See, you guys.
Hey,
all right. Those are
what's up, everybody?
That's where the arrow bee behind me is coming from. But if anyone wants me to, okay, now you're going over the top. If anyone wants me to come to a conference and be on a panel or whatever, I'm always happy to do it and kind of lend my expertise. So thank you guys for having me on. I'm really, really grateful.
Awesome.
Thank you.
Well,
Jamey,
everyone,
thank you, sir.
Quick housekeeping. Next week we will have one more session of our live video cast on Facebook before our conference. We're going to really get into what the conference is going to look like and how you who may not be able to come to the conference can see it live on Facebook, live on our public page to be part of it. We're doing Sports Center type of podcasting up on platforms, and it's all fun sorts of stuff. So this is going to be a millennial. I swear, this is going to be a millennial delivered and executed conference, which I'm so cool. This is going to be so cool. So have a good week. Hopefully for Mike that the Cowboys are still winning. I haven't checked the score, but we will see all of you guys next week. See you guys later.
Take care.
Bye, guys. Later, Blake. Later, Mike.
See ya.
Bye.